and we're speaking. I'm Matt Tannehill with
We met
Weather
for
Eyes.
Portland.
Oh yeah, very good to see you. How are you?
Good.
Yeah. Hi.
Hi, I'm
Matt Tannehill. Nice to meet
Nice to
you.
meet you.
Yeah.
Ryan Vaughn.
Oh, Ryan. Yeah, we've seen each other
Yeah,
before
the town
too.
hall and stuff.
Are you the
How you doing?
superintendent right
Yes.
now? Oh, we
Yep.
we had your name on the list to make sure we gave you our card. So.
Oh, yes.
My email, that's
Thank
about a
you.
month ago.
And birds in the morning.
We can send. Slides afterwards, or that we have a place to project.
Well, it's just time.
Melinda might be able to.
Yeah.
Show slides.
Yeah, she has to, I mean, well, man.
Never know.
If it goes for that, I know, yeah. Right. Yeah. Well, yeah. But yes.
Melinda's not presenting.
I'll ask her if she can, if she can present them for you, that she's got. Hey, Melinda.
Hello.
Could you show Claudio's slides when we get to that point?
I can do
Go
that.
through that.
Otherwise, I did email them to you as well.
Slides.
And just FYI, I didn't do any slide stuff.
I gave you a pass, Joe.
There's a little delay in the audio, so
Thank you, Monica.
so Melinda or Monica, can one of you show Claudio's slides? I don't think Monica has them, so
Melinda said she could, Scott.
thank you.
Dulcet tones, which I don't.
One thing that would make it.
So then we can do business, and if not, mostly what we have today are updates, so we can hold on the minutes until we get a little further in, but let's give it another minute if everybody can hang on. And Joe,
That happens to me all the time. I said, Joe, I get you. Kevin, can we fix that?
Who's getting? Okay.
Well, over and over. I love the area of broadcast and medical space. Somebody. Here.
That feel it? Yep, try it now.
We're testing the microphones to see if the recording loop is stopped. Well, how about that? That's an indication we should start and call the meeting to order before anything else goes astray. Again, we're one member short of having a quorum to approve the minutes. But I think we'll be okay for the time being to get going. So thanks everyone for joining us today for the South Central Regional Psychiatric Hospital Advisory Panel. This is our last meeting that fulfills our charge from 16 months ago or so. So we thought what we would do today is focus on updates, kind of project updates like we have been doing, but then also kind of going back to some of the key partners that have presented in the past and say how far have we come in the last 16 months or so, things that have changed, things to look forward to. And then we also asked, I think it's consistent with that, but our friends at One Rise to come in and give us an update on the project for the remainder of the site where we're in construction. You've got the agenda. We're going to make one little switch. Joan's got to leave early, so we'll move her up on the agenda. Maybe I'll push mine a little bit further down. But are there any other items that we need to discuss today or topics that folks on the panel want to make sure we cover? Okay. We've got Mark Bennett on the Zoom now. So Mark, if you can hear us, maybe we'll do an update and then we'll come back to oh, Mark's there. So maybe we'll just approve the minutes. So if we do lose somebody, we don't I don't know what happens if the panel dissolves and we don't have the final version of the minutes approved, but I don't want to risk it. So you should have minutes from our February 21st meeting. We've had a chance to look at those. Are there any adjustments, deletions, corrections to the minutes from February 21st? Don't hear any. Can I get a motion to approve? Sarah Lopez makes a motion, a second. And Senator Reddy seconds. All those in favor say yes.
Yes.
Any opposed? Hearing none, minutes are approved. We'll move into project updates. So we've got Adam Crocker and Tanya with KDADS and Tanya from the county to do some updates on construction. Invite them up, either come up to the table and sit or to the podium if you'd want, but
Afternoon, everybody. I'm Adam Crocker, Director of Facility Services for the new South Central Regional Mental Health Hospital. Construction updates: with the ground cleared and leveled last January 2025, key construction started on the excavation and starting utilities, as well as digging out and excavating the areas where foundation anchors and areas where the elevators will be seated. This last week, they were able to pour the concrete for the elevator seating areas, as well as stabilize some of those areas, make sure they're tied in, and that's going to be 3 areas for that. The subcontractors have been working on the site with UNRU performing the civil work on the ground clearing, leveling, and as well as a private project for extending Custer Road. Shell Electric has been working on the installation for utility conduit, along with Central Mechanical Wichita, also known as CMW, who's handling the installation of the HVAC with their conduit within the construction of the building. So progress on the building is continuing to move forward on a weekly basis. I was informed yesterday there are approximately 77 plus or minus weeks remaining for the construction completion. Not to put a panic in anybody, but it is a realistic expectation. With that said, progress is being made and consistently, safely, and mindful of the goal and the outcome. It's assured by weekly meetings with all of the people involved, including Key Construction, Sedgwick County, Pulse Design Group, Tesserae, and KDADS. Any questions?
questions for Adam? There is a site camera as well that's observing the site, 2 cameras actually, that you can have. We can put that in the chat so you want to continue to watch the progress. You don't want to just drive by, you can watch the cameras over time. Any other questions for Adam? Tanya? Oh, Sheriff, thanks for joining. Jason just walked in as well, so that gets us well over our necessary quorum. No, you're
Yeah, so I'm a little bit late.
for joining. Okay, Tanya, go ahead.
Okay, so Adam gave you the construction updates. What I'll give you is just a couple of updates on our expenditures. To date, we have spent on pay applications 1.2 million, and then we're getting ready to spend another 1.5 million. So that gets us up to 2.8 million spent on the project. We have processed one change order for approximately 200,000. That was for cement stabilization and flowable fill that had to do with the site development area. We're still currently working on coordination with MABCD on plan reviews. So we're working under a temporary, what are my words here?
Temporary building.
Yeah, temporary building permit. And then we'll get the final building permit in 30 to 45 days out. We're working with KDHE, who will be the licensing agent on this, so that we're working through. And then we've received final approval from the Kansas Fire Marshal on the plan review. Of course, working with Key and KDADS on the groundbreaking, which will occur on April 9th. And we have talked to the contractor for the site infrastructure, and that's related to the street improvements and utilities. And my understanding is that they are ahead of schedule, and that should be completed May or June of 2026. The last item then is just to give you an update. We are processing, and this has been approved by our county bid board, and then this will go on the commission agenda next Wednesday, and that is for commissioning. And so this is a commissioning agent that will come in and basically follow the contractor around and test all of our building systems. So that has to do with heating, cooling, ventilation, lighting, security systems. Basically everything that will go into the building. They will review all these systems and then come in later and train all of the staff. So that'll be the KDAD staff, train all the staff on these systems. And then basically throughout that entire year, come back as the seasons change and then continue to work with the staff on how that works and make sure that everything is working properly. So that will be hopefully awarded by the commission this Wednesday. So that's all of my updates that are not part of construction updates. So happy to answer any questions on those items.
Questions for Tanya? The commissioning agent, we've included that in the construction budget, or it's in the overall project budget. It's not an additional item, was built into the.
That is correct.
Okay, any other questions? See any? I put myself next, and I think I can be fairly brief, and then we'll have Arena do an update. So just a couple of things, legislative and budget updates is what I put. So starting with good news, the bill that we introduced to name the facility, authorize the catchment area, add the facility into the care and treatment statute, so it's part of the involuntary treatment system, and to extend the state security program to this campus. That bill got the Senate approval of the conference committee report last night, so it's on its way to the governor for signature. It's in House Bill 2249. There's another provision in that same bill. It started as House Bill 2365, but what's going to be approved is, well, hopefully if the governor signs it, House Bill 2249. A lot of effort, thanks to the sheriff for providing testimony about the bill and others along the way, advocates and stakeholders. So we're excited. We do want to talk a little bit more as we get into the program. So the one thing that may be unexpected if you read through the bill is we've for the 52 forensic competency beds, the way we think the most efficient way to operate that is as an extension of the Larned campus. So for courts around the state, for courts in this region, when they order somebody for competency, we want them to order that person to the state security program or its agent. And so the building here will be part of the state security program. You could still admit somebody from Sedgwick County Jail to our building, but administratively, we're going to track it through the state security program, the infrastructure that we've already got. We think that's the least amount of duplication. There'll be a staff here. That'll be separate, or it'll be integrated, but it'll be standalone. So we're not, the extension we think is a more efficient way to operate it going forward. For the care and treatment part, the involuntary for adults in acute crisis, that'll be standalone. It'll be a separate program here in partnership with Osawatomie and Larned. The other thing the bill does is explicitly says the Secretary of KDADS can transfer patients between campuses. So if we've got a space issue on one campus or a patient that needs the most secure level of acuity at Larned, we can move people around the system that we already had, but that had to include this hospital as well. So we're excited about that. Again, just happened last night, so we'll see when the governor reviews it and signs. But that puts us in track to create the agency for July 1. So from July 1 on, the hospital will have its own budget. We can create the administrative structure that's separate. Just kind of all those cleanliness things we need to be able to ready to open as the construction project continues. So that's the good news. The less positive news in the budget process. The state budget was approved as well. We can go answer more questions about it. A couple of things that relate to this project. There's an across the board cut of all state general fund appropriations that aren't for capital projects or for aid and assistance, Medicaid benefits, things like that. The state hospitals were exempt, but our building and our project is embedded in the KDAD's operating budget right now. So at least our reading at the moment is that some part of our $15 million annual appropriation that's in the current this year's budget and next year's budget would be touched by this 1.5% across the board cut. That's not great. It's good that our other state hospitals were exempted. We tried to tell or request that the legislature extend that to at least this part of the KDAD's budget. Timing wasn't our friend in those terms. And 1.5% is not a huge amount. Shouldn't touch the construction part of the budget, so we can keep putting the building up. It's really more on the operational side, which we're going to have a bigger ask next year anyway. So it's not great, but it's and something we'll have to account for. But that is in the budget just to make you aware. Otherwise, all the construction money's there, and we're ready to continue with the project. So I think that's the updates that I had about budget and legislative. We're providing pretty regular updates to our budget or we have an oversight committee that looks at Medicaid, kind of oversees everything that KDHE and KDADS does. So I give an update to them every quarter. So there'll be some legislative oversight there. And if I guess we have a real problem operationally with that across the board cut, I'll alert them and they can act on it or not, or I've done my job of updating them of what the impact is going forward. I think those are the two updates that I had. Any questions for me? She's not here, but Lee Keck has been part of this group or attended a couple of times, and she's our legislative liaison. We are blessed as an agency to have somebody like Lee to as many things as she tracks and as many things as she got done this session. It's just really remarkable. So I'd say thank you to her. So Irina, it's time for your update.
Good afternoon. Irina Yeromenko, acting superintendent of the hospital. Obviously, most of the progress is with the construction and daily reviews, but we're also continuing to make progress with the organizational design. Specifically, we have now defined several phases for hiring. And the first phase is from August 24th to June 25, where we only bring a few key people. I started acting in my new role. We brought in Adam as Director of Facility Services, and we're now getting ready to interview for the IT manager because this project is going to require a lot of the IT and both infrastructure and software coordination to make it a success. The second phase that is going to start from July 2025 and will continue for the next 12 months until June 2026. We are planning to bring in key clinical staff and a medical director with that, and also HR team to be able to help us with the phase 3 and 4, where we're going to bring on most of our employees. In phase 3, we're July 26 through September 26. We're planning to onboard most of medical staff and key director level positions and operational support positions, as well as legal, to ensure that we have all the policies in place and that we're preparing for the licensure and certification and accreditation process. And then phase 4 would be from right around the time when the building is going to be complete. That's October 2026 through January 27. We're bringing on therapy, psychology, social work departments, as well as licensed and non-licensed nursing, and the rest of the operational support. And at that time, we're also planning to onboard our key operational support contracts, including laundry, food service, facility services, contracts for maintenance. And so that's the plan. And as I mentioned, right now, we have just posted IT manager position and hoping to have interviews in the next couple of weeks. We're also working on sort of umbrella approach that is going to help us manage the system as a whole and bring on this hospital to work well with Leonard and also Otomy. And we have completed a major project that actually spanned across a few years at this point, that's developing an admissions approach. And we developed KDAD's admission policy, reviewed a lot of the documents and recommendations that came along with it. And that's for care and treatment cases. And at this point, we're also, as Scott mentioned, we're working on an approach that will make most sense for the state security program and the forensic side. Meanwhile, we are also, our initial plan was to bring on a clinical administrative director to early this year, but then we considered outsourcing development of the treatment program to give us more leverage and access to national level best practices. And the state has a number of companies on contract, and we are putting out task order to help us bring experts from around the country to develop a treatment program for the care and treatment side of the hospital for civilly and also the dually committed patients. And that should go out probably next week. And we're hoping to start having revisions and bring the vendor. We're hoping that we're going to get good submissions and bring on vendor in May with a goal to have the program developed within the next 6 to 7 months. We also worked on strategic planning for the next couple of years for the hospital that is based both and ties in with the construction. But I have a document here that we'll send out afterwards, but we developed the mission, the vision and the goals and what we're hoping to achieve within the next 2 years. And that's going to be something that we can share after this meeting as well. And a little bit of an update on what we have been talking about here for the last couple of meetings with the Citizens Advisory Board. We now have 4 approved candidates that represent clinical, medical community, law enforcement, advocacy organizations, and workforce development experts. We're still looking for people who either have a family member with lived experiences, so to represent families and consumers. And we are looking to have 13 people. So right now we have 2 more applications that we're getting ready to review. So we'll be at about 15% or 50% at this point. So if you know anyone who is interested, please let us know. And then the other piece, we also talked about the foundation. We are still exploring how we would like to go about that and what's going to make most sense. But we also received an offer to partner with the Lane Foundation. And so we are looking at that as an option as well to bring in more efficiency and make more sense for the organization and the patients. Oh my, that's all. Thank you.
Questions on those elements? Joan.
Senator Reddy had her hand up before I did.
I'm sorry. Thank you for being that honest. I wasn't paying. Senator Reddy, go ahead.
Yeah, no, thank you. I was trying to find my little button for the raising hand. Yeah, I just have a couple of questions. And this may have been done in the past, but how many staff are we looking at the end of the line to be fully functional, including directors, nurses, support staff, everybody?
Well, the maximum number of positions that we said was 388, but I think realistically, most of the hospitals around the country are not staffed at that level.
So what is the normal, like, what are they staffed at? Even if our goal is 388, what would make it still function adequately?
I would have to break it down by positions because those positions include both operational support and clinical staff. And again, some of the positions, for instance, if we take physicians, that's going to be a matter of the load that the physicians will need to take on unless we bring on full medical staff. And with the nursing staff, I don't want to make up numbers in my head right now, but I can look up what would be the minimum percentage of the nursing staff that would be required to staff all the beds.
Okay. Yeah, no problem. Because I do know that's one of the things people have been working on as far as licensing, certifications, micro-credentialing, how all of that would work as far as salaries, especially if we're talking about budget cuts instead of increasing the budget and how that might align. So that was my reason for asking that one. My other question is for the Citizens Advisory Board, and this may have been mentioned in the past, are you looking for somebody within that region or anywhere within Kansas that fill in those roles that you're looking for?
Yep, that's a very good question. So typically what other state hospitals do is looking for representation from the counties that the hospital is serving. With that being said, really with the forensic side, I think the hospital will be serving more counties than are just surrounding. So really, if there are folks who are interested in participating and represent the state as a whole, then that we would definitely welcome that as well.
Okay, that sounds great. Thank you. I appreciate all the information.
Thank you.
Joan?
Yeah, my question is related to staffing as well. Is there any possibility that you would be willing to share? I know you post the jobs, but but I'm just wondering if you're able to post what that staffing pattern looks like and the salary structure for those positions, just so we see how we're lining up as a community.
So based on the positions,
Yeah,
sure, I think we can pull it up and, it, I think we can do it here the next week or so, pull up the information on most of the positions.
yeah, mine was related. The other question I had was the same as Senator Reddy's, is what is your goal, not what your aspiration is, because we all have aspired to certain staffing patterns, but we don't get there.
Sure.
That was it.
Thank you.
Yeah. Do you think we'll have to, as we get a little bit closer to opening, think about the on-ramp of patients? So, I mean, the number of staff we need is going to be directly proportional to how many patients we're going to serve. We got to get people trained in the building. So I think we'll have some kind of the phasing in that as well. And it's a bad answer, but reflective of our other campuses. I mean, we're at about 50% nursing vacancy or less at Larned. We supplement the remainder with contract labor. So that will certainly be an option here as well. Not a great option, and not where we'd start. But yeah, I think we'll have to look at that kind of on ramp of, we certainly want to use the beds, and we want to use as many of them as we can on that first opening day. But we'll have to be realistic with what our recruiting looks like. We will have to figure out how to share the salary ranges and number of positions and things when we don't have this forum anymore. So, and I don't know the citizens advisory, it probably is relevant there, but certainly working with ComCare and the local in the area, mental health centers and hospitals, we can figure out how to do that in another forum when we don't have this platform anymore.
That would work. And it's not like I don't see you.
Yeah, that's right. Okay, any other questions for Arena? Maybe just to tag on. So again, Adam that we've hired lives here. Our intent would be for the additional positions that we fill kind of from here on out, they're going to be Wichita based people or based positions. And it may be we recruit somebody in but we're going to need people here on the ground, both for all the recruiting, for the program development, and maybe they won't start living here, but the expectation would be that by the time we're open, they're going to be residents of the area. So again, we're not going to, I'm not relocating, so my involvement will still be from Topeka, but the intent is to staff to have people here running the facility for the community here. Okay, any other questions? All right, I'm gonna move Joan up on the agenda so she can present before we go, and Sheriff and Mark, and since you joined again, our sort of updates on the agenda going forward from here are sort of where we've come over the last 16 months or so. We've had presentations early on about resources in South Central Kansas, gaps in the service system. So we just kind of wanted to update where those systems are, issues that you're seeing that we need to be aware of before we close out our business here. So Joan, with that. I think you're still muted.
Yeah, and I didn't craft a formal like PowerPoint or anything, so I'm just going to talk through. And my understanding is what kind of things have changed for ComCare and community impact since we started this group. So I'm going to start with that because we've done a lot of development. You know, we're a CCBHC, and we've tried to fill some gaps. So one of those gaps is persons that are experiencing a first episode of psychosis. Our hope is to engage them sooner in services. And so we did receive a grant from KDADS to develop a program based on an evidence-based practice. This has been an extremely beneficial program. While it doesn't touch large numbers of folks, it touches enough individuals that our goal is if they become engaged and medication compliant early in their disorder, they'll maintain that medication regimen for their lifetime and not wind up in higher levels of care with Claudio or the sheriff. I'm sad to report that yesterday we received notice that the grant funding for that was one of those that was impacted by the federal executive orders. But we're going to work hard to move that into our revenue fund so we can continue it, because I'd rather treat somebody at the lowest level of care than wind up serving them when they're in high need and crisis all the time. And particularly our youth who have a whole future, and quality of life early is important. We have done a lot of work around mobile crisis response. I think if you look back 16 to 18 months ago, we did not have a full 24/7 continuum for that service, and now we do. We have 18s that cover the 24/7, and we've gone from having a response time of over several hours to under 32 minutes for an average response time, which is pretty darn remarkable and well within acceptable limits for our CCBHC certification and evidence-based practice. So we're proud of that and proud of the work that our staff have done to get there. We have worked with the sheriff and the DA. We are now, in addition to doing competency evaluations for the courts, we now also do mobile competency restoration, which means if somebody is determined to be incompetent, we work with those individuals to help them become competent so that they can actively participate in their own defense during their trial and court proceedings. That's kind of a complex service that we're doing. You know, some people respond very well. Some people are not competent by the time we finish up that restoration, and they ultimately do wind up having to go to Larned State Hospital, because as a mobile competency provider, and we can't force medications, and so oftentimes it's a medication compliance issue, and they're not able to actively engage. But that's something new that's happened since, and Scott, you were involved early in developing that and getting the CMHCs to help tap into that waiting list, and we appreciate those efforts. Since we started meeting, we've embedded mental health staff into the 911 partnership. So during the hours that they're on staff, the 911 dispatch have the opportunity to transfer those mental health calls to our staff, who try to de-escalate the situation to prevent a 911 response. And if a response is needed, our hope is to dispatch a mobile crisis response team versus using law enforcement, fire, or EMS to make that response. We have partnered with WPD and added an additional 4 teams. We call them collaborative response teams. They are dispatched directly by law enforcement to either meet law enforcement on the scene or to take care of the mental health crisis in the community. I think right now we're in the process of exploring if we will have dedicated police assigned to those teams, or if we'll keep some of them available just to respond to any law enforcement who may have a need. That's been really productive and has really added another layer of response in our community. So we have 8 mobile crisis response teams, and we have these 4 new collaborative response teams, and then we still have ICT1, which is the paramedic, the law enforcement officer, and the clinician. So Sedgwick County is got a lot of active street work going on, and I think I would think that Sheriff Easter and Mark Bennett will say that these are value added to our community and certainly helpful to WPD as well. Let's see. We have also been working very diligently. Tanya's in the room. She has all the technical knowledge behind this, but we have been working on our new crisis center design, and we have been very, very actively engaged with our architects from Helix and Co. They have been wonderful to work with, and we have managed all the way through the space needs, the floor design, the security needs, the IT needs. And I believe that that is now in the process of getting permits for the construction bids. And so I believe we are a few weeks behind on that project, but hope to catch up. But I think the most important thing to share with you with regard to the new crisis center build is that we had to think long-term what the need would be in our community. And so in addition to having the walk-in opportunities we currently have, in addition to having the mobile crisis response teams report out of there, in addition to having crisis observation, crisis stabilization beds, we had to think long-term about what our partnership is with the hospitals and with law enforcement. And so we did build in a 5-unit crisis intervention center into that future build. We have not worked yet on pursuing licensure for that. That has to occur within a certain time frame of when you're opening. Scott oversees certification and survey. We have started conversations with those KDADS folks. We met with them to determine what pieces of, for example, they have to have their own area for food preparation. It can't be part of your larger crisis center. So we had to self-contain that unit in that build. And so they have provided us locations to drop those construction documents, and they will start reviewing those so that we can determine what waivers we need to seek from the state to make sure that we're in compliance for when we're ready to get our licensure as a crisis intervention center facility, in addition to our crisis stabilization unit, that we meet all those requirements. That's a pretty exciting shift for ComCare. We have not wanted to get into the involuntary work, but we recognize that our hope is that we can move them from an involuntary bed to a voluntary bed by having the full continuum there on site. The other piece of the new crisis build is we have built in some bed capacity to provide not only, we partner with SAC, so they do sobering and social detox on ComCare's behalf in that crisis center. And we're working closely with them to look for financial funding to have medical detox beds so that we could do medical detox outside of the intensive care units that Claudio has to oversee. So we've tried to be creative with looking at what our long-term goals are with that crisis center and building that facility so that we could respond to community need and community gaps. That's a biggie. That center, of course, we're hoping to break ground sometime in the near future once those construction bids are secured, and then hopefully have an opening date for that new crisis center in the late winter 2026. And if not, it will be early 2027. So lots of progress being made there. And that has been a really fun project, but I have to admit there's so much language when it comes to construction that thank goodness we have Tanya and Andrew who are quick to respond and decipher what things mean when we don't understand what they're asking. The other piece that I think is important to communicate is we are also in the process of we have started training staff on chat and text. We have to do that through the National Lifeline's Vibrant system. We hope to get that up and going here locally in the very near future. I asked for an ETA this morning. We had hoped to have staff all trained by the 31st of March, but there were some glitches in the technical sandbox that we're training staff in. And so we're a little behind on that, but we hope to catch up soon. And when we do roll that out, we'll roll it out with limited hours to start. So it'll be daytime and early evening. And then once staff are confident and we know what it takes to manage that chat line and text line, then we'll roll it to 24/7 stuff. So there's a lot of information and a lot of activity going on with regard to ComCare. I will say, when you asked about gaps or concerns, I do know that with the new screening process for state hospital admissions, there is now a requirement for potential for folks that have a potential deficit that we have to use the cognitive capacity exam. And there's universal concern across the CMHCs in Kansas that that tool is ancient, not validated, and could restrict access for people that really should benefit and can benefit from admission to the state hospital. So I just want to throw that out for reconsideration. The CMHC crisis directors have dug into that, have some recommendations as an alternative tool. But since you were asking what gaps and concerns we have, I wanted to make sure that I represented our crisis teams and letting you know that that's really a pain point for us at this point. There you have it. That's update for ComCare.
That's a lot, remarkable amount of work. And on the last point, we have heard that about the cognitive capacity screening tool, identified some of the same kind of issues and are certainly willing to see the recommendations, but would like to engage in working on what a better option would be. That again, I think we're aligned on the purpose to identify people who maybe aren't going to benefit from treatment because they've got intellectual disabilities or something else, but we need a better tool to figure that out, that you can do at the screening, at the point of screening, which that there's a balance there of there are much longer tools, much longer screenings, but we've got to figure out how to do that in a way that can be done rapidly. So
and we'll share the one that our staff have seen that might be a benefit.
That would be great. That would be great. Thanks, Joan. Any questions for Joan? There's a lot.
And I don't have any questions, but I just want to throw out a kudo for Senator Reddy, who wrapped up late last night and is on our call today. Thank you for joining.
Yeah, thank you. But unfortunately, I'm not in the Senate right now, so I didn't get elected back. So thank you, though. I wish I did.
I didn't know that. I'm so sorry.
No, I'm sorry too. So we'll see. But I did have a question for you, Joan. I think all of the things you have just said I think are extraordinary. I don't know where Medicaid is on all of this. So when you start seeing all of this, and now that there's so much discussion even about immigrants or undocumented folks, where do they fall into line when you do your assessments and competency tests and with your staff? How does that work? Or does it not matter?
Okay, I'm going to ask the county folks to cover their ears when I respond to this. We don't ask their legal status. We ask their residents.
Okay. And that's what I thought, because in schools, we don't do all of that either. So I was just wondering how all that works. But yeah, I appreciate, this is a ton of work all of you are doing. And with so many policies from the federal level as well as the state level that seem to be not well, it's just so fluid right now. So hopefully you keep continuing the good work you're doing. And I really appreciate all you're doing on the ground. Thank you.
Thank you. We know there's going to be unintended consequences with these executive orders.
Right.
And many of the services that Joan talked about that they've been developing, we've been developing from KDADs are all Medicaid. There's a Medicaid element to them. So crisis intervention centers, that's an important step there as well to access Medicaid funding as part of the, not everybody's Medicaid eligible, but for those that are, there's a place there as well. Great question. Other questions for Joan? You have to drop early, but so thank you for your contributions, Joan, throughout. We know you haven't seen The Last of Us either way, but thank you for your contributions over for this group for sure.
Thank you.
Claudia, you're next on the agenda.
Sure. Well, Melinda pulls up. I did prepare a short
slide deck for this, but while that's happening, I can go ahead and give a physician and psychiatrist coverage update since maybe the last time I had engaged on that topic. So just to reground everybody, we have 101 beds over at St. Joe inpatient and a partial day hospitalization program. That's primarily the group that covers our adolescents and adult population. And of course, that 101 beds is made up of, from adolescents all the way through geriatric. And covering that, we've been quite challenged over the last probably 8 to 9 months. We did have a cadre of 4 psychiatrists that were full-time. We are now down to 2. I think we did report that. We've done some creative solutions, I think, to help bridge that gap because the demand has not decreased since that time. And, we do spend quite a bit of, and we're grateful for all the partnerships that we've had along the way with ComCare, KU Group. But in addition to that, we've implemented telepsychiatry in a number of locations. Again, for us, we're trying to manage inflow and throughput because capacity will always be challenged and we would never be able to kind of create enough. So it's very encouraging to hear, strategies to get folks seen and having needs met early in the process before crisis is met. But we've implemented our telepsychiatry program at all 3 of our hospitals. I don't know if everybody knew that, but so it's at St. Francis, St. Joe, and St. Teresa in the emergency department. And so that telepsychiatry service has really helped our throughput and our discharge to community or home. So we were admitting pretty much anybody who had a medical or a medical psych condition found their way into St. Joe, and it was just a log jam. So what we've been able to do with that implementation of our telepsychiatry, they're able to more concurrently, they're managing patients more concurrently and with greater frequency. So they're able to stabilize and really keep the ball of therapy moving. And it's been a great help to our ER physicians as well as now even in our medical units. So they're covering our EDs and they're covering our medical units for any time somebody has a medical and a secondary diagnosis of psychiatric condition. So it's helped tremendously from that standpoint. As a matter of fact, our boarding hours, at St. Joe, that was something that was really always challenging, and we still are challenged by it. But just with the introduction of Clear, and we've introduced a part-time psychiatrist live at St. Joe, we've been able to decrease our boarding hours that was north of 13,000 hours a month to we've achieved a low of about 6. So now we're hovering about 8 to 9. So considerable reduction in the overall boarding. I'm not carving out behavioral health, but that was a big chunk of it just because of the capacity with the inpatient bed. So our telepsychiatry, having contracted with 2 additional psychiatry providers, one's KU, one's a community physician, we've been able to really have some achievements made. We're also doing a better job with adherence to admission criteria and exclusion criteria because we were taking everybody and what was happening is you couldn't place them later on. And so we're trying to get the folks in who we can really do something with and for, as opposed to those that are not. So we made some steps there. We see about 500 behavioral health visits a month in our emergency department and have about, 400 admissions per month in the psychiatry area. And so that's quite a bit of volume that occupies our St. Joe campus. We've recently engaged in some conversations with KU to possibly look at interjecting psychology, a group of psychologists into the mix with some of our, I'm not going to think of the right term, the therapy, not the activities and, the forgot the right term, but so they're looking at interjecting that. And then also we're engaging in a conversation with WSU. They're interested in looking at creating a PA fellowship in behavioral health. So they're looking to have, by the time it's mature, maybe 3 to 5 fellows. And so we're working collaboratively on different fronts to get different talent to address that need. So lots going on there. We still are recruiting psychiatry. We don't have any active candidates as we speak. So that work continues. I'll stop there if anybody has any questions regarding more of the staffing and the psychiatry coverage, et cetera. Before I go into the.
I don't have a question for you, Claudio, but the drop from 13,000 to 600 hours is pretty amazing.
It's about 6,000, Joan, not 600.
6,000, sorry.
I may have misspoke.
I might have misheard.
But yeah, it's been felt and appreciated, and especially with our expansion that I'll talk about here in a second. You know, we've gone from 29 beds to 26 beds because we've had to take 3 out to create a new entrance, and so we've since reduced that, in addition to closing down our psychiatric observation unit that was 11 to 12 we could take. So we've taken some capacity out of the system. The throughput has been the key. So. All right, well, given that, I'll just go ahead and give you a presentation, or just short 4 or 5 slides talking about our emergency department expansion. If you can advance to the next slide, Melinda. So a little bit of history, and of course, I've mentioned some of this. We are 250 beds. We have 110 behavioral health beds. I think most know that we serve as a hub for inpatient behavioral health. About 16% of our emergency patient population presents with a behavioral health complaint or issue. I mentioned all the boarding. We did receive the $22 million grant dollars through the help of KDADS. Thank you so much, to really right size the ED for the current volumes and what we've been seeing. So that work is underway. If you'd advance to the next slide. So what we're doing is we're adding an additional 21,000 square feet, and it will add 20 additional beds to, I said 26 is what we are now, but officially we were 29 when the project started. And then we'll also add 11 beds for a psychiatric observation area and rapid stabilization, with the intent of, again, increasing safety and security, addressing privacy. We want a safe environment for our patients and for our staff. And so really something else to help in the expedition of throughput and moving patients along in the system. Go to the next slide. So we're doing this in 3 phases. Right now we're in phase 2, but phase 1, you can't really see it on this map. Kind of you can, but there are 2 brown extensions that depict the envelope increasing on the building. To the top of the screen, which would be north, we did an enabling phase, which we have taken down a building and created new emergency department parking that allows the envelope to go west, closer to Clifton, if you're familiar with that area. And so that also paved the way for a new sane start area that now occupies where our previous assessment center was. So they've doubled their size to be able to do that. They're operational as we speak. So phase 1 is complete. Phase 2 is really now we're starting to move out into the parking area, create the envelope to then move the existing operations into the new, and then retrofit and complete the inside for full operation. So at the end of the day, we will have, again, 49 emergency department beds and then 11 beds of psychiatric observation unit. So we anticipate to be operational April, May of 26. We're still on time, on budget. So next slide. And I just think these are just some of the updates that I just rattled off. So there are some pictures we too have. You can see there's a time lapse video. We have a live site video cam, and I think if Scott or Melinda send this out, you can link on the video if you're interested in looking at pictures that or live video of the site, but it's quite exciting, and we're looking forward to being able to address the needs of all those who come to us for care. So, next slide. That's it. Any questions? All right, thank you.
A lot of thinking about timelines that, it's all seemed so far in the future. And now we're within 12 months or so of your project being done. And it's think about some of those operational elements now once the timelines get closer to being reality. But thank you for that update. We did mention the psychiatric PA program or the fellowship. We tried to get some representations from WSU to come in and talk about work that they're doing on all of those workforce pipelines that we've talked about through WSU Tech, some of the other colleges in the area. So there's marriage and family therapy, forensic psychology fellowships, or practicum development. Wichita WSU Tech is working on a behavioral health tech credential, so something kind of lower level licensure, but on the path to either psychology, psychiatry, marriage and family therapy, or nursing. So lots of work going on there. We didn't get anybody identified for today, but again, that's all part of all of our work together throughout. But thanks, Claudio, for that update. Sheriff Easter, you're next on the agenda. If there are updates you'd like to provide over the last 18 months or 16 months or so.
Not so much updates. I think since now we are down the road with the building, site selection, we're getting ready to break ground, those type of things. When the chief came, when he first came here, I met with him and discussed with him just the kind of ongoings of what's been going on the last few years. This was one of the topics that we were looking at a hospital here. Once the ground was selected, it came to my attention that MacArthur Street is county and the actual grounds where the hospital is being built is city limits. I also want to make sure that I understand exactly how this is working. At the end of the day, when all this is completed, that will be a state-owned building. Is that correct? And not a county-owned building?
That's correct.
Okay. And so what we're used to here with ComCare, JDF, some other county buildings that, police department utilizes those services, they drop that person off, that client, and then they become our responsibility if they have to be transported somewhere else because it's a county-owned building. This one's going to be different. And I had talked to him about the fact that, our inmates that are going to be housed in there for either evaluation or restoration will take care of any issues with those particular inmates because they're actually still in our custody. That we would have a further discussion on how police involvement or law enforcement involvement, what that looks like at the state hospital aspect. We're at that point now where I'm going to have to sit down and have a discussion with him and his staff and my staff on how this is going to look. My first question is there somebody from the state hospital or from KDADS that wants to be a part of that conversation? Because there's going to be questions on how you guys operate, what kind of calls you're talking about, and those type of things.
It'd be Arena would be the
Okay.
primary contact there. I'm certainly happy to be involved, but I think that'll it's related to the operations, and so that would be Arena's portfolio.
Okay, that would be great. And if I don't have your email, I'll get your email, Arena. So I appreciate it.
No, we'll reach out to you. You don't have to worry
Okay.
about that because we have the same set of questions, so we
Yep.
want to make sure we're in front of that as well.
The second piece of that is there any way with either Larner or Osawatomie So we have a better idea of what the state hospitals call law enforcement for, to respond to, larcenies in the parking lot, those vandalisms, I get that. Are we called to assaults on staff inside the hospital, that type of stuff? Is there any type of statistical information that can be provided so we have a better idea of what we're looking at?
Be happy to provide that because we've gone through at both Larned and Osawatomie over the last 2 years, discussions with local law enforcement about what we ask them to respond to and how they respond. It's a different at both for the 2 campuses, but at Osawatomie, for example, if there's an assault on a staff member or a patient-to-patient assault, we call, we do a 911 call and it gets routed generally to the Miami County Sheriff. Sometimes Osawatomie PD will respond. But those are things that we talk about with both the police department and the sheriff's department about, is that appropriate when and honestly, we've had several discussions with Miami County and their county commission about, the burden Osawatomie State Hospital creates for Miami County because now the sheriff has to respond to an assault, patient to patient or patient on a staff member for somebody who's not from Miami County, but they're putting them in the Miami County jail for some length of time. And so we've worked through that. And
those are all questions that we'll have as well to see how we work through this. And like I said, the easy part is the inmates that you're treating that's in my custody. That's a no-brainer. Those are our inmates. We'll respond to all the calls on that. It's this other stuff that we kind of have to figure out because it's located in the city of Wichita. Those aren't in custody of the sheriff's office. So how we work together to give you guys the best services.
So, but we will need to talk about if it's something that happens on the involuntary treatments on the care and treatment side of the hospital. Those aren't people who are in your custody or didn't come through a path from the jail. So would that be one that just operationally how do we do
probably talk about?
And
we can work all the way through this just because I have inmates in there. Well, as far as from the not the care and treatment side, but the evaluation and the restoration side. Well, the rest of those inmates that are in there that didn't come from this county, they came from another sheriff. And so, my kind of thoughts on this is if it's that side of the house, then you make a 911 call because they've assaulted other staff or other people. We dispatch our people because all those people in the custody of some type of sheriff. The other side of the house has nothing to do with sheriff's offices, and they're located in the city of Wichita. But I'm not convinced of that yet. I mean, that needs to be part of the discussions with the police department as well, being in the room.
Yeah, we have that data available and historically, so we can kind of show you what it looks like over time as well.
Wanted to say that these are some of the questions that we had as well, and we're hoping to discuss. Another piece of that is also how do we handle everything as a community when there is a medical need. And I talked to Claudio before about that. What do we do? How do we work together to make sure we observe all the rules, laws and regulations and but also work smoothly as a community in that.
Yep.
So I'll reach out and definitely we'll schedule something to start the conversations.
Yep. Nope. Sounds good.
It's not your area, but fire support is another one that comes up quite a bit, which we can have. You don't want to be part of that conversation, Sheriff.
I mean, EMS is going to respond countywide, so maybe they need to be in the original discussions on, okay, what does this look like from an EMS standpoint? But from a law enforcement and fire standpoint, I can, whenever we decide to meet, I can get Chief Snow there as well because, again, this building is in the city limits of Wichita.
Sure.
But I would also ask Doug, because it's right on the outskirts with Chief Williams for the county, because a lot of times they co-respond to stuff. So just getting this all lined out with police, fire, and EMS, and then moving forward with a plan from there.
And another area is also emergency management and starting with the general plan of how do we all tie that together up to the state level, but also for things like radios and communication and the frequencies that we need to tune on in and all of those details as well.
Okay. Irina, what might be best then is you email me who you would like to have at this meeting from the local contingency here, and I will reach out to them. So if that's emergency management, both fire departments, police, both police and sheriff and EMS, if there's other folks that you think of from here that could, that there's questions of and how we should handle things, you just let me know what those entities are, and I'll figure out from here who's in charge of that type of stuff here. Does that make sense?
Sounds great. Thank you.
Okay.
Thank you, Sheriff. That's kind of you to offer. I know that's more than is on your plate, but that's helpful.
There's no reason to have separate meetings. We're all in public
Agreed.
safety, so we might as well get it all ironed out at the same time.
Thank you.
Yeah, absolutely. That's all I have. So I appreciate it.
You didn't, Joan mentioned the competency work that's happening inside the jail or in coordination with ComCare.
No, it's going well. Yeah.
Talk about that as well.
Yeah, no, they're coming in here. They're doing that. They're doing some of the restoration, as Joan talked about before. That's a little bit of a struggle. But some of it's going on. Some of it just comes down to they have to go to Larned. I mean,
Right.
there's not a lot that the local or ComCare can do with them. And so, but is it helping with some of the population? Absolutely, with the evals it is. And then with some of the restoration.
So what we don't have, what will be new to us is the scale of the jail in the same county as our facility. I mean, Larned and our work closely with Pawnee County. They've got 4 cells in their jail. So we don't get a lot of inflow from Pawnee County directly, but we work with other counties. So we'll just need to talk about how that works of triaging and when, what we would see, I think, is when you're saying we need to send somebody to Larned, their first stop is going to be, if possible, to the facility here in Sedgwick County. And to provide the services that Larned would have provided, unless it's somebody who's really aggressive, really violent, then we won't have the capability. But we'll just have to work through that. That'll be new for us. Just being transparent about that. We won't have it all figured out right now, but we've got.
It will be because we've had a few inmates that were extremely aggressive, did a ton of batteries in here on staff and other inmates and those type of things. And because of what Larned is capable of up there, they weren't placed up there. I understand here it might not have the same capabilities, so we'll have to work through that.
Right. And involving the DA's office as well, because there'll be maybe amending orders and things like that. So lots to other things to work on that'll be new for us.
Yep.
Any other questions for Sheriff?
All right.
Okay. Thank you. The last update we had is from our partners at OneRise. Ask Matt and Leanne to either come up or you can. Sure.
All right. Well, thank you all. Yeah. So good afternoon, everyone. My name is Matt Tannehill. I serve as the president of OneRise. I just want to first thank this advisory group for the critical work that you've been doing to get this project to where it is today. Your leadership has been really foundational to making this vision a reality. So today we're here to really purposely share some updates for OneRise, especially the results from our most recent strategic planning session that occurred. I'd say we've entered a season of really focused action driven by community voice, strategic alignment, and a deep belief in the hospital's long-term success. So just to touch base, for those unfamiliar with OneRise, again, we are a local 501c3 non-for-profit. It was kind of birthed from the private sector through the Lang family. really our mission is to help transform the behavioral health ecosystem by focusing on innovation and prevention, treatment, and aftercare. Our first step is building a trauma-informed or recovery-focused health and wellness campus right alongside the state hospital, one that scales and strengthens the broader system by serving as the connective tissue between crisis and recovery. So strategic planning incorporated a lot of community engagement, including input from housing experts, service providers, hospital partners, and more. And our board has set forth some immediate priorities that closely align with really what this panel's established as some goals. So some of those pieces that I'll talk about here is really researching and launching some sustainable funding pathways that ensure long-term stability for campus-based services. So when we think about the hospital on the campus, we want to identify how we can be a conduit to helping with strategic strategies that go into the care and provision there. We've heard that expanding aftercare services for individuals transitioning out of hospitalization or acute care is a severe gap in our community. We want to really see how we can be a conduit via the campus and externally to help in reducing the recidivism and advancing long-term recovery through coordinated community-based solutions. So I hear from a lot of the entities here that we would love to engage with to figure out how we can be really proactive in that. In addition to that, we've been really talking to some providers around the housing solutions across the continuum, really trying to be proactive from either transitional to supportive and a variety of different modalities of housing that can provide additional ease to discharge planning, promote stability, and again, reduce the pressure on the crisis system. Additionally, we've been really intentional about looking at the campus infrastructure on additional services. So from prior conversations, it's still being elevated within our community of establishing a federally qualified health clinic, health center on campus, just from a synergistic perspective of individuals as they leave hospitalization and again, wrapping around that person and their families. Additionally, we've been in conversations with a childcare provider. We really want to be proactive in helping workforce. If there's additional barriers that are going to be more burdensome for those that are working in these conditions, how can we be proactive by bringing additional resources that help in retention for those that are doing the work. We really want to elevate joining in partnership with entities such as the Kansas Behavioral Health Center of Excellence. We've been in conversation with WSU Tech, but really helping drive the workforce pipeline solutions by assisting in development of additional pathways, whether that's, additional training, specific housing as it relates to workforce, but just, again, retention to meet the current and future staffing needs. So however we can be involved in that, that's been a strategic driver for where we're moving forward. And then additionally, we see our role here as really helping reduce the stigma around the public narrative around mental and behavioral health through education, storytelling, campus design, and community. I think we have a really great opportunity here to set a new precedent for what mental health is and helping reduce that stigma by incorporating innovation around the campus. So how we can be a conduit for that. So again, we're here to complement. OneRise is designed to be a catalyst for collaboration. And really, we want to be a tool of support that amplifies the incredible work that's already going on. Our hope is together that we can generate lasting impact in creating a model that not only serves this region, but inspires other system level transformation beyond it. I have Leanne Miller here with me to really speak to some other additional technical pieces on how maybe we can assist the hospital directly.
Thank you, Matt. It's nice to meet all of you. This is my first opportunity to be in front of this group. I'm the Chief Strategy Officer for OneRise. I've been with the organization since July. So thank you for the opportunity to present to this group. In a few conversations, we've educated Scott with KDADS about what OneRise can offer and how we can complement the state hospital. We are a separate 501c3. So OneRise is a standalone 501c3, and we have the opportunity to bring foundation support, as well as being able to help you and other entities raise philanthropic dollars. And we know that that's something that's a priority for the state hospital. And so we want to offer that as an opportunity for us to partner. We understand that you all are exploring that, and we want to make sure that you know that that's a possibility, even if it's an interim type situation. We can, and we would be honored, and our board would be honored to help with that strategy and helping educate the community that they can actually give to OneRise. Those funds would actually be restricted to support the state regional mental health hospital, the initiatives that you want. You would have complete control over the disbursement of those funds. So we want you to be able to have those resources available to you. It does take a long time to establish a 501c3. So if that's a gap that we can fill for you, that is something that we definitely want to offer. As we've said, that our board and our leadership are definitely committed to making this a success. And we want the campus to not just be a campus, but we really want to make it a place for care. We would offer this possibility to any entity that comes onto campus to use OneRise as a 501c3 to help them further their fundraising and nonprofit activities. So we don't want to be seen as a competitor. We want to be seen as a collaborator and helping with that collective impact. We also, Matt and I have served in the social services industry here in Wichita. I personally have been in social services for over 25 years. I've seen the competition that has occurred across different social service sectors. And if we can actually be collaborators versus competitors, I think we will all achieve what we're looking to achieve. And it will actually be person-centered care and actually person-centered focused metrics. And so that would be what our goal would be. We want to make sure that those bridges are there, and however we can actually make that happen. That is where we want to be aligned, and we want to bring partners to the campus that are in alignment there. We are vetting all of the different partners so that they understand that this is a system, this is a continuum of care, and they need to understand that we are all working towards the same goal, and that is the individuals that we are serving. We believe that together we're standing at the intersection of possibility and purpose. This hospital is the foundation. You are the very first entity that is going to be on the campus, and we are very grateful for that. And we also believe that this could actually build a precedent for around the country. And we want to be the beacon and show that this is possible. We also want to thank you for the opportunity to invest in this area of the community. I grew up in South Wichita, and to see this happen in South Wichita is amazing. And I know that has a lot to do with Sarah's leadership. And I'm grateful that the Lang family took this as a project and was willing to donate the land. But for you to say yes to South Wichita is amazing. And we are here, stand ready to help and work with you. So any questions, we'd be happy to answer.
Questions for Leanne? Certainly appreciate everything that OneRise has done and contributed, elevated the conversation quite a bit of what's possible, and just also your willingness to listen to when you ask what we need from the state hospital. I think you've gotten pretty much the unvarnished version of we need places to discharge people. It's not about our treatment. It's about sustainable, supported housing, employment opportunities, all the things that we've talked about. So you've been very open to those concepts and ideas as well. Okay. Let's see. So before we adjourn, I want to just take a minute to thank everybody, since this is our last meeting. Now I got to figure out how to approve the minutes. We don't want to keep sending you emails for things. We do want you to be alert and aware of things. We have a couple of takeaways that we need to get out. So we'll do that. You all should have gotten an invitation to the groundbreaking on April the 9th at noon, and would love to have you there. The governor's coming. We've invited a number of legislators from the area and others that were involved in the project. County commission, city council, and city leadership as well. So hopefully it'll be well attended. If you come, please be prepared to put on a hard hat and turn over a shovel of dirt, because you're as involved in this building project as anybody. And we want to make sure if you want to do that and participate, we want you to get that opportunity. I do want to just take a couple of minutes. I wrote notes down, which I rarely ever do, but I didn't want to forget anything. So I do want to thank the panel for your service over the last time period since we came up with this idea of having the governor appoint an advisory council to kind of guide and make suggestions for this project. We knew we wanted to involve the community. We knew we wanted to build something that would be important for South Central Kansas, Sedgwick County, Wichita, and wanted to have a way to have those voices being heard. This advisory panel appointed by the governor through an executive order is a very formal way to do that. But I think structure aside, it's been a really important part of the project for us from the KDAD's team to really be to make sure we're on the right path, that our tone is correct. And I don't think that would have happened without your guidance. And because I thought about it, took some time to think about it and wrote down the notes, I thought about, well, what was really the value that the panel offered that we couldn't have gotten another way, or we wouldn't have gotten another way. And I came up with 3 things. I think it was largely about the vision of what this hospital would be. When we proposed it originally in the governor's budget process, we said we wanted something we want regional capacity, we want state hospital beds, that level of care that we provide. But to get it here, what is it that we got from this panel? I think one is you've all been extremely clear and consistent on the vision of what patients we want to serve in this facility. You wanted to serve competency criminal defendants who need their competency evaluated. That was always on the table. You wanted to serve people that would otherwise be in a hospital emergency room that need involuntary care. There was no question about that. And maybe other things came up over time, but we stayed consistent with that, and that's where we are. The second was you wanted to make sure whatever we do at this hospital, it's in cooperation and in collaboration with existing services. And that's reflected in the makeup of the panel, of the kinds of information we've tried to bring together. But that was clearly your vision in partnership with us. But that's been part of the discussion all along. And I hope you don't spend a lot of time thinking about your service here, but if you do, I hope that's one thing that you feel like we accomplished was in hearing from each other, making some connections that maybe weren't there before, and we'll do better for people because we're cooperating across different services. And then the third, and this one was probably the most important to me, is the focus on regional capacity in South Central Kansas. It would have been very easy to think about this building as only serving Wichita or only serving Sedgwick County. And I think every time I ever brought that up or used that terminology, there was somebody on this group that brought it back to, this is not about just Sedgwick County, it's about the region. And I can't, that's been extremely helpful to me. It's been extremely helpful as we advocate for this at the State House to talk about, we're not just talking about Sedgwick County, we're talking about the whole South Central Kansas and the whole system. And that, if nothing else, that comes from this panel's guidance and suggestions. So I thank you for that. Just in terms of other themes, you directed us and supported us and wanted to gather public input, and the ways we did that. Did we do enough? Did we do the right things? I don't know. There's always probably room to improve, but you gave us clear direction on the points in time when we needed to gather public input, how to do that, where to bring it back to. That was extremely valuable to the project. Doesn't happen everywhere, so I thank you for that. And that even level of specificity was very helpful to us in terms of putting our work together and vetting the project and getting us to where we are. Certainly, I maybe having a panel was optional at some point in the project, but really, in looking back, I wouldn't have wanted to get to this point without the involvement of a group like this representing the interests that all of you have represented. That's really added so much to the project, to our understanding of the community needs and expectations. And I think, you know, I won't be in this role forever, but I think for the project itself, it'll be the involvement of the community, and this panel will be baked into the facility that we're building. That's certainly our intent. And I think just by the nature of your involvement, it's going to happen as we structure it and go forward. So every time we, you know, there's concrete going in the ground, or we're digging a trench, you know, that it's a very tangible evidence of that we're building something here. But as that facility grows, you know, over the next 6 to 9 months, 18 months, well, anyway, over the next time period, again, I hope you see your involvement in it and something that you can be proud of going forward, just like we are. So thank you to the panel. We've got some recognition items that we'd like to give the panel members today. This is not so that you don't come to the groundbreaking, but we didn't want you to have to carry something else. Arena, could you distribute? So we'd like to, I'm not going to formally present, we're just going to hand those things out, but we did want to give you something to recognize your service, and want to make sure you get that to take away. There's 2 other groups I want to recognize, and then I will stop rambling and let you go on with your days. But I want to thank the Greenbush team that's been our advisors and supporters throughout the project in terms of, well, coordinating this meeting and a lot of the public meetings. Monica Mernan, who you've met before, Ryan, who's here in the room with us, Bonnie, Don, Lisa Pelkey, who helped compile the reports, and a lot of the subpanel work group effort. That's just, as most of you know who've worked on things like this, it's just so much effort to take all of that input and distill it into something that's meaningful and useful, and in this case in particular, actionable. Easy to write a report and then it goes on the shelf. We had specific things that we wanted to accomplish and follow up on, and that is largely because of the involvement of the Greenbush team. So the public meetings that we held, again, we can, and I probably will spend time evaluating, did we do enough of that? But the ones that we held, I think, were extremely well done, very effective in terms of what we wanted to get across and communicate with the public. You know, maybe we could have taken every question and not had Monica try to read off note cards and interpret people's questions so there was something meaningful every time. But just that level of service and intent to gather public input is just tremendously valuable to the project. And so our appreciation goes out to Greenbush for their involvement in the project. And we have a recognition item that we're going to send with Ryan. You're going to have to get it from him.
Well, Scott, we just want to say thank you to all of you for allowing us to be part of this. Man, once in a career opportunity. This is a big deal. None of us live in the area, but we feel like we're part of this project, and we thank you for including us.
You're very, very welcome. And then last, I would be very remiss, and Sheriff, you shouldn't let me out of the county if I didn't thank this next group. The Sedgwick County team has just been tremendous through this project, and I can't thank them enough. Tom's only getting one recognition, but Tom, I think it has a lot to do with Tom's leadership as county manager. You know, I think when we started 2 years ago or 3 years ago as part of the budget process, or this was a recommendation that came from the governor, but it was building on and consistent with recommendations coming out of the county. And it was really easy. It could have been a confrontation between the county and the state of where this was going to go, where the building was going to go, or where the funding would go. We got really lucky, I think, from the state perspective, or my perspective, to find such a willing partner as Sedgwick County to work with us. Tom, before we started, had very kind things to say about our involvement. Other than I just repeated it, but I mean, I know from a state perspective, we're not always seen as the best partner to local government or anybody, and there's truth to that. And I won't argue the merits of that, but probably a lot of reasonable level to be skeptical of the state coming into this as a partner. But Sedgwick County, we approached it with openness, and I think the proofs in the project and the work that we've done. You know, there's a lot of money on the table. We've got an extremely complicated project structure of the county acquiring property, building a building, turning it over to the state, running the bidding process. We couldn't make it more complicated if we wanted to, but it's worked remarkably well and continues to work well. And I think that just has a lot to say about your county government, the people that work here, their commitment to public service, and even in the face of things that you'd never think would work, their willingness to move forward with that. So we appreciate that. Two people in particular that I do want to call out. Tom, sir. These two folks back here, Tanya, Cole, and Andrew, they've been through every step of the way. I have to talk into the microphone or you won't be able to hear me, but I'm talking to them. I'm looking at anyway, you understand how microphones work. But Andrew's been great. His expertise in navigating the county processes, making sure, and just the building projects. Joan was right. You know, we're in public service or in human services. I understand about a third of the, not a third, 20%, 10% of what's happening in most of these construction meetings. But Andrew slows it down, asks the right questions. You've got a real, you're very fortunate to have him on your team here. And we're fortunate that he's shared some of his time with us. And Tanya Cole, I don't know, I've worked in government a long time. I rarely meet people like Tanya who are so dedicated to the project and understanding systems and processes and navigating that. And she doesn't have to do this for me. She doesn't have to do this for KDADS. But she's dedicated to what we're trying to accomplish because it's the vision that the county commission and the county administration has put out there, and she knows it's the right thing for people. Again, that's a pretty rare thing. That's a pretty rare thing anywhere you work, but it's a rare thing in government. So we're very lucky to be included in your team and your community. We value it so much. We very much appreciate all of the contributions of the Sedgwick County team. And I didn't even mention they donate this space, and Kevin's here running the IT and has done that for the town halls, and Nicole's done a lot for us on the just the outpouring of support. And I don't mean just, feelings, tangible things to help us do our job is just incredible. And anyway, we've talked a lot about it internally within KDADS of, when we get frustrated, when there are times that things aren't going so well, I bring up this partnership as an example of, we can do this. We can do this with Sedgwick County. We can do this with there are some other counties that would be harder, but we can do this with Sedgwick County. We can make things work because the willingness is there and they understand the mission. So that's my too long attempt to thank you all for your efforts and contributions and recognition, and just where we are. And in a couple of weeks, we're going to break ground on a site where the ground is already broken, and we'll make it work. But again, I hope in October, November of 2026, you'll come back with us and you'll walk through this building, and you'll be proud of what it is and what it can be, and who it's going to serve. So that's my last pitch. I would ask for questions, but I'm not going to do that. So if there isn't any objection or any other comments anybody on the panel would like to make before we adjourn. Senator.
Yes, thank you, Scott. Yeah, I was so proud to be a part of this team. I think all of you did an outstanding job. Mental health has always been something that I've strived to work to make better in the state of Kansas, and I think we are doing that. Even though I'm not in office currently, I am thrilled to see this coming to the first phase, in my mind, coming to an end, so we can start the implementation and the groundbreaking and then fully opening it. I will not be able to be there for the groundbreaking, but I would like to be kept in the loop about updates that are coming up, or if there's anywhere you would like me to be, or if there's anything going on and I might decide to just show up and take a tour or be part of any subcommittees that are still open or anything of that sort. I think this is something, it's an investment for the state of Kansas, and I hope we continue to put money into it, because this to me is more of about the economy of Kansas. If we can keep our people well and stable and provide them resources, they will be better as employees or for their families or as students and whatever it might be. So thank you for everyone that put in all of this long time and effort into it. And I'm really proud to be a part of it. Thank you once again.
You have a standing invitation to visit Larned or Osawatomie when you want to get out of Manhattan and see another part of the state. More than welcome. Okay. With that, we'll adjourn for today. Thank you again for your time today. We will send the minutes around just because we want to close that out. We may not get a vote, but again, thank you all for your time and dedication over the last year and a half. And hopefully we'll get to see you on the 9th. All righty. Thank you.